Chief Customer Officer at SZV answers frequently asked questions. Local cardiologist and member of the Heart and Stroke Foundation speaks about heart disease. And President of the WICUA says the SCDF should rethink and reflect. Those are the headlines for Tuesday, January 26, 2020. Good evening, viewers. This is SXM Daily News, and I'm Valerie Van Putten. Thanking you so much for joining me this evening. And as usual, we have a full newscast for you, so let's get started. In our first story, the news that the SCDF was in the process of organizing their annual festival has been met with resistance by many, including the healthcare and frontline workers at the St. Martin Medical Center. President of the Healthcare Workers Union, Brunilda Illich, speaking to SXM Daily News and the Voice of St. Martin Radio earlier this morning, and flanked by board members, the president says that it is not right that healthcare workers have to be put in danger, but she says she knows for a fact that if they overload our healthcare and frontline workers, it will not be good. When asked what is a suggestion to the Council of Ministers in that Carnival should be cancelled overall, the WICUA president said that they should rethink and reflect. Reflect on your family and reflect on CPS. Meanwhile, board member and registered nurse at the St. Martin Medical Center, Reinder Torenga, says that he has no problem with Carnival on the whole. He did, however, give his view of why he is against Carnival this year.
I really take really serious notes, especially for our frontline health care, frontline nurse, because we are directly in contact with anyone that becomes sick, right? And that's an overload on our nurses who have done such a good job in the first beginning of the corona. And then you all nominate them, or let's say the community nominate them people of the year. Now you're killing the people of the year. Okay? Now, we eat corned beef. We eat sardine. We eat crackers, which was such a good move from our government. Now you're telling me I got to prepare the nurses' mind again to go deeper into COVID. Aruba done got 5 of the new strain. We're going to get it too. And they say that is even worse than the first strain. You know what's so hurtful when you hear that? When the young people had put their little Jouet morning, okay? The first thing they did, they come out and they ridicule those young people. They pick them up one for one, those who they could identify, and they put them in jail. No, you want to take and have everybody who enjoys Carnival, the smart one. All of us here is Carnival rebels. I'm a Carnival animal. You understand me? And that's from young. I used to dance 3 times a year Carnival. Aruba, St. Martin, and sometimes the St. Martin group used to go to Chicago. Okay? And I used to go. But I know for a fact, if we overload our health care frontline workers, it's no good. Don't talk about the police. The police will be all close up under the drunken people. To stop them. What they gonna do? They'll make costumes. They're going to take up from side to side, and you put a barrier between each person for them to dance Carnival? No. Let us put Carnival, leave every house, put on the music, dance on your porch. You dance dance on your porch. I see other countries had singing from their house and they was enjoying it and feeling good. I got a car wash in front of me. When they put on their music, I get soaked on the porch, man, and I jam. Huh? So why? Why, if are you so care for the community, why are you giving green light for carnival? Think on us for real, not fake. Rethink, reflect. And don't reflect right now only on the frontliners. Reflect on your grandmother, your grandfather, your children. Huh? Reflect on the people from CPS. Huh? Reflect on them and rethink. Come up with something else. Tell the people play music on their porch. That's my suggestion. Huh? And it is sad. It is so sad. I think we put money, the finances, above the human beings.
My problem that they allow carnival is from how can you allow carnival if you even have a maximum of people attend to church, like 15, or you shut down churches, and people even can't go to a funeral without saying farewell to somebody and decency. You have to walk in and you have to walk out. I mean, small gatherings, not more than 50 people are allowed because of the COVID restraints. So how in the world can you have a carnival parade thinking everybody will keep the distance? It will never happen because when the parade approaches, everybody will go forward, get close on each other. Even in the small supermarkets now all over the island, when you go in the supermarkets, nobody controlling, the majority walking in the supermarkets without a mask on your face, breathing on your neck. So for me, Carnival is a big no, no, no. Next year again.
Are you afraid of the healthcare system being overwhelmed based on the announcement?
Yeah, especially with the British mutant going around. You have the other mutants from South Africa. I heard one yesterday from Brazil. I think if that mutant hits St. Martin also, the hospital will get overloaded again. Like, we did a good job. All the healthcare workers did a good job. Everything is stable now. And I believe it's good to keep everything stable. Because if after Carnival the hospital is getting overloaded with COVID patients, the normal care, like going to a doctor at the outpatient clinic, maybe it will get in danger. The hospital will get overloaded. It's not good. It's not good. The normal health care will be jeopardized. And I think we should not get to that point because it's a danger for everybody.
And in other news at this time, the St. Martin Heart and Stroke Foundation is organizing the second annual Wear Red Day in the form of a mini symposium, which will be held on Friday, February the 5th, 2021. However, due to the COVID-19 pandemic last year, the foundation had to cancel some of the events for 2020. Local cardiologist and member of the St. Martin Heart and Stroke Foundation, Dr. Emiko Bird-Lake, speaking to SXM Daily News Department about heart disease, elucidated about heart and stroke and the awareness. She said that COVID-19 alone already brought palpitations and a higher heart rate to heart patients, and that causes heart problems.
We had planned a car raffle, and we also had in November an event planned for heart and stroke patients combined and do outdoor in an outdoor setting to be able to do some sport events even for the stroke patients. I have a stroke patient and he's also a heart patient, and every morning I see him walking. And despite his limitation, he walks every day. So when I see him in my office, I'm like, I saw you walking again. So even though you have had a stroke and you have an impairment, it does not mean that you cannot do certain things, but you have to adjust. Your lifestyle has to adjust. So it was for us unfortunate that we had to cancel those events, but nevertheless, awareness has to continue. COVID cannot take over our lives. And so we still have to go out there and do awareness because COVID also has an influence on the heart. And with that in mind, that's why we also did about heart and rhythm. Many people have had palpitations before, not understanding exactly what the palpitations are. However, with COVID, we see that, anxiety social, just talk about social economic problems that have occurred because of COVID. People have lost their jobs, they are anxious, they are fearful. So that alone already brings palpitations. But also we've seen that COVID itself, the infection itself, causes a higher heart rate, it causes palpitation, and it causes heart problems. So with that, all of that combined, it gives us the right opportunity and the right time to talk about heart and rhythm. But not only that, I have a new colleague, and I'm really, really happy with that. It's Dr. Han Spierenburg, and he's a device cardiologist. Arrhythmia and pacemakers, that is his specialty. So he will also be doing a presentation about an irregular heart rhythm abnormality, which is called atrial fibrillation, and a lot of people have atrial fibrillation, and because of this irregular heart rhythm, it can lead to a stroke. So everything is linked to each other. And then we've invited our pacemaker technician, Miss Simone Arthur, and she is also a certified nurse anesthetist. But we educated her here and to become a pacemaker technician. So she will also give a presentation about what it means to have a pacemaker, how do we treat patients with heart rhythm problems with also a pacemaker, and what other type of pacemakers or devices do we have that can treat heart rhythm abnormalities. So it's going to be a diverse presentations that we're going to have, a mini symposium with different topics done by different people, and also a psychologist team maybe that will also address the anxiety. And the reason it's called a heart and rhythm because the palpitations or the extra beats or things, we'll be talking about all of that, and that's something that is very, very common on the island.
Dr. Bird, heart disease such as coronary heart disease, heart attack, congestive heart failure, and congenital heart disease is the leading cause of death for men and women in the United States. Talk to us about heart disease here on the island. What are the leading causes of death among men and women here, besides cancer, of course? Mm-hmm. And are we contributing to our well-being, or are we ignoring the advice and doing it as we please?
Well, I will start with, are we ignoring the advice? Because we know that a lot of people on St. Martin, we have a diverse and multicultural community where high blood pressure, hypertension, and diabetes are prominent. And we have patients who are very compliant, meaning they go to their follow-ups to the general practitioner, they take their medication, they've changed their lifestyle, and they're doing the appropriate thing. However, we have a bigger group that is not going to the GP on a regular basis, that is not taking the medication consistently on a daily basis, and are not following up with their appointments. Now, because of COVID and because of Irma, we've had some problems with financial issues by patients. But even before that, we had the non-compliance issues. Why? People believe that, medications have side effects, and if they have side effects, they prefer not to use them and go to the herbal, the teas, the herbal medications, or other things which are not, I don't say that you cannot use them. I do advise you to use them, but in combination with the medical therapy that you get from the general practitioner or from the cardiologist or from the internist.
And still to come, Minister of VSR partners with healthcare organizations for COVID-19 vaccination support. And I'll have the details to that story and more when SXM Daily News returns.
Hi, I'm Switch.
And I'm Save.
And together we're here
to tell you about WIB, Switch, and Save mortgage offer.
Now at WIB, you can save and benefit from great specials when you decide
to bring your mortgage to WIB.
When you switch, WIB will offer you
payment of penalty fees up to 3 months interest,
payment of notary fees,
waive of bank closing fees,
and also the lowest interest rate.
Plus, you'll have the chance to win back 1 year of interest payment.
Visit any of WIB's mortgage specialists and benefit from WIB's Switch and
Hey, that's my part. And Save mortgage offer.
WIB, your partner in progress.
Welcome back, viewers. You're watching SXM Daily News, and I'm Valerie Van Putten. As we continue now with other news, the Minister of Public Health, Social Development and Labor, VSA, Richard Pandefleck, was accompanied by the head of Collective Prevention Services, CPS, Mrs. Ava Lista de Weaver, who met with Red Cross officials Sebastian Kachadurian, Regional Program Manager for Food Assistance Program, Lauren Manguiro, Humanitarian Diplomacy Advisor, and Fanny de Suarte, Head of Mission Recovery, IRMA, to discuss support from the Red Cross with the launching of the COVID-19 vaccination planning and implementation process. In addition, the support from VSA to the Red Cross food program was also discussed. The project manager for the vaccination program arrived earlier today and was very useful in the first phase of the pandemic earlier last year. The Red Cross was also very supportive in the first wave with a community outreach program and the Ministry of Public Health, and is once again looking forward to receiving the same support this time around with the COVID-19 vaccinations. And as we turn now to other news, in our new series beginning this evening with our health insurance providers, SZV, before the COVID-19 pandemic hit globally, SZV was already in the process of improving and trying to get their services put online, as well as providing continued quality service. SXM Daily News had the opportunity today to speak to Chief Customer Officer at SZV, Mrs. Parveen Burche, about some of the most frequently asked questions.
Types of information that you can gather yourself without actually contacting SZV. So let me speak about those self-service options in a few. But the fastest way to contact SZV is via our website, szv.sx, and there you will find a ton of information. We have it sorted out, so if you are an employer, or if you are an employee or a senior, you can navigate your way through the website, or you can use the search option that we have on the website, where you can type in a search word, and it will lead you to the different pages that have that word in it. So I can highly recommend the search options.
So it's very user-friendly.
It is definitely user-friendly.
Anyone can navigate through it.
Yes. If you can be on Facebook, you can also be on our website. Okay. Speaking about Facebook, that is also one of the options that we have. Facebook is a great way to communicate with us as well. You can find daily updates on our Facebook page, and then my colleague Sharon can talk a little bit about that. And you can also message us via the Facebook Messenger. And we've seen that a lot of clients are using that opportunity as well to get in touch with us and to get answers to their questions.
Okay. Yeah. Okay. What can one do online without calling SZV?
Without calling SZV, there are many items that you can do online. For example, we have recently launched our My SZV portal. And in that portal, you can see what your insurance status is. Is it valid or is it not valid? I have to say, not all insurance types are available as you will read in the terms and conditions, you will see that those that are insured under FZOG are not as yet on the portal. They will stick with their old-fashioned card, I would like to say. And also the recipients of medical aid, they will also receive a card. But all other insurance types and clients that are insured will be able to check their status online. So that is one of the many options of doing business online with ZFV.
Okay, great. Now, what to do if one does not, what can one do if they do not have an email address?
Yeah.
Get one, right?
Get one or ask assistance. We know that not everyone is able to get an email address or currently have one. But I would like to take the opportunity to point out that many, many more services are online or will be online. For example, utilities, telecommunications. So the use of the email address will be more frequent in the future than it was in the past. So if you don't have an email address as yet, please make sure to have one. Also have an email address that is tied to you as a person. So we do not recommend sharing email addresses because at ZFV, you will use your email address as a username to get access to all our services.
And now, turning to our weather forecast for January 26, 2021. The Atlantic high pressure ridge will maintain gentle to moderate winds across the region. Patches of low-level clouds associated with a frontal boundary will cause occasional showers. Seas will continue to deteriorate and peak at 9 feet during this forecast period due to the effects of long-period northerly swells. Therefore, small craft and high surf advisories have been issued. Small craft operators and sea bathers should exercise caution. So the outlook through Thursday midday, partly cloudy with isolated showers possible. Now, let's turn to your 3-day forecast. And still to come, 133 confirmed local COVID cases. We'll have the local update right after this.
The innovative Banco Matico contactless smart card. Your Banco Matico smart card is now equipped with a contactless feature for payments, so get ready to tap and go. Contactless payments are fast, easy, secure, and accepted worldwide at all Maestro-enabled contactless terminals. Tap for transactions equivalent to or less than 100 NAF, or the US dollar equivalent. You will receive notifications via email anytime you tap. Tap, tap, and pay fast. Fast with WIB. For more information, visit our website at wib-bank.net. Tap and go with your partner in progress.
How are you doing this morning? Good. So Rebecca, thank you for coming. I work as a psychologist at the Mental Health Foundation. I mainly see children and adolescents, but I also see adults. So whenever there's a crowd, that's when you're starting to feel
nervous.
Okay.
nauseous.
Okay, it is kind of like your body. We are so used to taking care of our body. If we have a little ache in our foot, we know to rest it. We know, okay, I might have walked too much, so I need to rest. Now, of course, that can be just an ache in my foot, but I can also break my leg. Now, for breaking my leg, I would have to go to the doctor. So that kind of goes the same for mental health illnesses. So you can come in for something little as, I'm really stressed out lately. What would you need? A little bit of rest. But someone can also come in with way more difficulties. We're not here to judge right or wrong, good or bad. Is it helpful for you? Fine. Is it not helpful for you? Okay, then let's see what we can do about it. But not a wrong nor right, absolutely not. It's a magnifying glass without judgment.
Well, there's still a lot of stigma on the island, unfortunately. It's not a topic that people easily talk about, and that's a shame. They're afraid that they get judged, and there is still quite a bit of judgment. I mean, often we hear, don't go to that crazy house. Once you go in, you never go back. And it's just not true, We treat a lot of patients here, and a lot of them we get back on their feet.
Our goal at the Mental Health Foundation is for us to help you improve your life, for you to live a better, happier, and fuller life.
Welcome back, viewers. And as we end this edition of SXM Daily News for this evening, as of January the 25th, there were 9 persons who tested positive for COVID-19. However, 21 persons have recovered, bringing the total active cases to 133. The total number of confirmed cases is now 1,758. The Collective Prevention Services, CPS, are monitoring 133 people in home isolation. No patients are currently hospitalized at the St. Martin Medical Center due to COVID-19. The total number of deaths due to COVID-19 remains at 27. The number of people recovered since the first case surfaced on St. Martin has increased to 1,598. 262 people are in quarantine based on contact tracing investigations carried out by CPS. The Ministry of Public Health, Social Development and Labor, VSA, the airport health team, in collaboration with the healthcare laboratory St. Martin Services, have tested 2,279 travelers arriving at the Princess Juliana International Airport, while CPS has tested 13,533 people throughout the community. As the numbers continue to fluctuate and to further control the spread of the virus, Minister Panafleck advises everyone to take the mandatory guidelines implemented seriously. It is your responsibility and duty to protect your health. And with that, viewers, it brings us to the end of this edition of SXM Daily News. I am Valerie from Putin, thanking you for joining me this evening. And just a reminder that this and other programs are available online. Simply log on to stmartinmediacenter.com for viewing. And on behalf of the SXM Daily News team, we thank you so much for watching and plan on meeting you right back here again tomorrow.